A warm, a warm welcome to all. Myself Remya, lecturer, Humanity College of Pharmacy. Today I am going to discuss about anti-anginal drugs. Let's move on the introductions. First we know about angina pectoris. Angina pectoris is characterized by sudden, severe pressing, chest pain or heaviness radiating to the neck, jaw, back and the arms. It is often associated with diasporiasis, cacophonias and nausea. Diasporiasis means sweating, fast trachypnea means fast breathing. Angina is caused by coronary flow that is insufficient to meet oxygen demand of myocardium. In simple expansion of angina pectoris are angina pectoris means chest pain caused by reduced blood supply to the heart muscles. Then see about the symptoms of angina. Severe chest pain or heaviness. Pain may be spread to neck, jaw, left shoulder and arm. Sweating, fast breathing, nausea, etc. Then angina caused by the heart muscles need oxygen to work properly. When coronary blood flow is not enough to meet the oxygen demand, if the myocardium occurs angina. Then types of angina. There are three types of angina: stable angina, unstable angina, variant angina. Stable angina means attack are predictable by exercise, emotion, etc. It lasts for several seconds and subsides on rest. Stable indicate the reproducible nature of the angina, the same activity at the same intensity faithfully produce symptoms. Angina can spread anywhere between the belly button and the jaw, including the shoulder, arm, elbow or hand, usually on the left side. Then unstable angina. The unstable angina is characterized by recurrent attack of angina. It occurs with minimal excretion. It is precipitated due to the combination of atherosclerotic plaque or platelet aggregation at ruptured plaque and vasospasm. Symptoms of unstable angina are sudden chest discomfort, sometimes even while lying down or with a minimal excretion. Then patient is worse and can last for a longer period than stable angina, may be accompanied by nausea, sweating or shortness of breath. Then variant angina. This is relatively uncommon pattern of myocardial ischemia, usually occurring at rest or during sleep and often in young individuals. It is induced by coronary artery vasospasm. It generally responds promptly to vasodilators. Symptoms of variant angina are intense chest pain, often occurring at the rest or during sleep, sudden pain that may last for the several minutes. Pain typically subsides once the spasm resolves. Then let's move on the anti-anginal drugs. These are the drugs used to treat angina pectoris. Then classification of anti-anginal drugs are first nitrate, then beta blockers, then calcium channel blockers, potassium channel openers. Nitrate, the drugs are glyceryl trinitrate, isosorbide dinitrate, isosorbide mononitrate. Then beta blockers, atenolol, propranolol, metoprolol. Then calcium channel blockers, nifedipine, amlodipine. Then potassium channel opener, nicorandil. Then see about the action of nitrates. The nitrate drugs act directly on the smooth muscles of the body and relax them. Nitrate first release their nitrous oxide which is a powerful muscle relaxation most predominant in vascular smooth muscles, that is walls of the arteries and the veins. Then action of nitrate. Effects on other smooth muscle, redistribution of coronary flow, afterload reduction, preload reduction. First of all, preload reduction means nitroglycerin relax vascular smooth muscle and dilate both atrial and venous vessel. Dilation of vein is more predominant than dilation of arteries, result in peripheral pooling of blood and decrease the venous return, decrease preloads. After reduction, nitrate also produce some atrial dilation, decrease the peripheral resistance and reduction of afterload. Then redistribution of coronary flow, dilation of coronary artery, then increase the blood supply of myocardium. Effect on the smooth muscle, relax the bronchi and esophagus muscle. They also dilate the cutaneous vessels and meningeal vessels. Then let's see about the calcium channel blocker. These are the drugs used to block the entry of calcium ion into the smooth muscle and the cardiac muscle, then decrease the intracellular calcium, then cause smooth muscle relaxation, then it leads to vasodilation. Then see about the beta blocker. The drug used to reduce the cardiac work and oxygen consumption. Then see about the potassium channel opener. These drugs are prominent actions of relaxation of smooth muscles. Then the therapeutic use of anti-anginal drugs. The nitrate drugs are used for angina pectoris, myocardial infarction, congestive heart failure, cyanide poisoning, esophageal spasm, then biliary colic. Then beta and calcium channel blocker drugs are used for hypertension, angina, then cardiac arrhythmias. Then adverse effect of anginal drugs are first nitrate drug causes the adverse effect of headache, methemoglobinemia, contact dermatitis, then postural hypotension, particularly with the sublingual use. Then calcium channel blockers, the adverse effects are constipation, headache, dermatitis. Then beta blocker, the adverse effects are hypotension, depression, bradycardia, heart blocks. Then see the contraindication of anti-anginal drugs. The contraindication of anti-anginal drugs, the nitrate drugs have cause hypersensitivity, severe hypotension, anemia. Then beta blockers, the contraindications are heart block, pulmonary edema, cardiogenic shock. Then it contains two common drugs are used for angina pectoris. First one, glyceryl trinitrate means nitroglycerin, then isosorbate dinitrate and isosorbate mononitrate. These are the drugs are most commonly used for angina pectoris. First, nitroglycerin. The action of nitroglycerin are decrease the preload, decrease afterload, dilate coronary artery, dilate atrial venous blood systematically. Side effects of nitroglycerin are headache, flushing, hypotension, dizziness. Contraindication of nitroglycerins are hypersensitivity, severe anemia, increased ICP, cerebral hemorrhage. Then isosorbate. It contains two drugs, isosorbate mononitrate, nitrate, isosorbate dinitrate is a nitrate like nitroglycerin and is used for treating and preventing angina. It is not used to treat HTN. It's given sublingually or per oral sublingual. Isosorbate have slower onset and longer duration of action as compared to sublingual nitroglycerin, because sublingual isosorbate does not relieve the chest pain as rapidly as nitroglycerin. Isosorbate is limited to treating acute angina in patients intolerant or unresponsive to sublingual nitroglycerin. Route of isosorbate tablets are isosorbate mononitrate 20 to 40 mg orally, then isosorbate dinitrate 5 to 10 mg sublingually or orally. These are the anti-anginal drugs, mechanism, contraindication, therapeutic use, adverse effects, etc. Thank you.